That's what I'm talking about. Now we have to make up for lost time. Here we go.
Oh.
I told you I haven't had a drink in 2 days, right? So it's hitting hard. You ready?
Cheers.
Cheers.
Which reminds me, we forgot to do a shot glass thing again.
All right. For sure, this next week we're doing a challenge, a shot glass.
We got shot glasses we bought for the show, and we keep meaning to do like something fun to give them away. Families drink, Kiko. Have you not been to my family reunions? Are the drunkest people you've ever met in your life.
I mean, it's the whole reason I started drinking so hard was when I had kids. Definitely, it's kid friendly. I used to make my kids race each other who could open a bottle of wine faster, and my younger one beat my older one when he was like 6 years old. Yeah, life goes. Okay, all right. Are we doing it?
Yeah, we're spinning. Oh, did you shot or what? Wait,
no, we're spinning it. I already did my
shot. Yeah, baby.
Okay. I need this one because we've had COVID on the wheel for the last like 3 weeks and we haven't gotten to it. And there's a lot going on. And I think that the biggest thing going on is the complete fusion of the vaxxed liberals and the anti-vax crowd just alighting so many different issues and basically making it you do you, pandemic is over, live your best life, otherwise you're being racist or a total hypochondriac. And it is just jaw-dropping to see how our government and the people in our country are dealing with 500 people dying every day.
Yeah, well, literally the only difference between the establishment opinion about COVID and the anti-vax left, like the left that's sort of the COVID minimizing left, I'm going to say, not anti-vax, because there's reasons to be anti-vax. I can accept some of them.
Yeah.
The only difference is the Democratic Party says get vaxxed and we'll do nothing else. And that's all that matters. And the COVID minimizing left says, don't get vaxxed, but nothing else matters. Like we don't care about masks. We don't believe in science of masks. We don't believe in science of boosters. We don't want to talk about air condition, air quality,
cleaning the air, ventilating,
and
nothing.
And the government should do nothing on all this stuff, just like the establishment wants them to do nothing about it.
Yeah. So they're trotting out all these people. This guy wrote something this week. I'll show you his name in just a second. It's time for the scientific community to admit we were wrong about COVID. Intellectual elitism, credentialism, and classism must end. Restoring trust in public health and our democracy depends on it. And he goes on to talk about basically how there were a lot of people who were silenced when they were skeptical about vaccines. And he sort of relies heavily on Black, brown, poor communities who showed more skepticism about the vaccine, and says that it was the elite's racism to silence them. And but again, like never talks about, and learning loss. Of course, they always bring that up and how that affects, communities of color so much more, which yes, it does, which is why we should be funding our schools and improving the quality of public education and getting rid of, any impediments to that. But they never come up with that. It's always just get their asses back in school and go back to work.
And why not get their asses back in school if this is your argument? But we're going to provide air quality protections and masks because we are not fucking idiots who don't believe in these basic scientific principles. Why do you have to believe everything? It just reminds me so much of how conspiracy theorists believe every fucking conspiracy. Like, what is it about your brain that you have to believe every conspiracy?
Right. And the truth is, if you want,
Well, no. But if you're a COVID minimizer, I think it hurts your narrative if masks work. So you can't face that masks work. You have to pretend that long COVID isn't real. Because if long COVID is real, all the bullshit any of them spread is just not worth it. Like,
Right.
Like,
So here's one example. Here is deaths per million people. That very sharp high line on the graph that then kind of continues and still outpaces every other country beneath it is the US, of course. Way down at the bottom is Singapore, and other Asian countries. This is just so you see masks in Singapore between February 2020 and July 2022 stayed pretty much up, apart from one dip, above 80% of people who wore face masks in public places. So again, if you don't want to get vaccinated, I understand there's been a lot, there is a reason, and you should be skeptical of big pharma. I mean, they have had to pay out billions of dollars over the decades in, false advertising and the way they've lied about different medications. They even lied about these vaccines, even though every study does show that you have a much better chance of avoiding COVID in serious infections if you are vaccinated. But okay, I get it. Like there's a reason. Yeah.
but the point is, if and I'm not, I mean, I get called Big Pharma Pat lately by some of the worst people.
Oh my God.
If you're anti-vax, I mean, at least just embrace some masks. Like,
yeah. But they act like
that hard.
Exactly. Wearing a mask lowered the odds of testing positive by 83% if you're wearing a KN95 or an N95. 83%.
Yeah.
And then they talk about the kids. It's not a big deal for kids. Meanwhile, we're seeing, well, in New Zealand now, more children aged 0 to 9 years old have been hospitalized than adults 50 to 59. SARS hospitalization ages adult cognitive capacity 20 years. So they're saying that your brain is basically atrophied to the extent like you're 20 years older. So let's hope it'll be different for all those kids who were just hospitalized. I don't know what the lie about it, and then, yeah, go ahead.
Can I just show this clip? Because I want to talk about this, and I don't want to podcast beef, and this is not a podcast beef. But it's really important to me that COVID misinformation, like if you're believing a lot of this COVID misinformation and you're perpetuating some of this stuff, you're harming people. So like this really matters. So I just want to look at, I want to debunk some things without talking about the person and personalities. This is a clip from the Door Show, and it's just full of entirely bullshit. So here you go.
That's the COVID narrative. And as soon as I looked into it there, and they're still lying at every turn. And now we know it causes more myocarditis than COVID does. So it has what they call negative efficacy, meaning if you take the vaccine, you are worse off than if you didn't take the vaccine. When everybody, because it's going to take a couple of years for everybody to realize the amount of lying that has happened, the hoax that has been pulled on people. We were never at a threat from this virus. It was only a threat to elderly people, people with comorbidities, and the obese. It was never a threat to children. It was never a threat to healthy people, and we never should have taken this fucking vaccine.
Let's just take a really quick look. Yeah. I mean, this is your risk of myocarditis with Pfizer. It's much lower than with Moderna versus a COVID-19 infection. I mean, what is that? Like 4.5 times as much, right?
Yeah. Where's our other graphics on that? We had
well, that's from that same article. Annual, I know we have so many different things here. Transmission also not true. Yeah.
Okay, so when they talk about, here's the myocarditis people, right? Their whole argument for myocarditis carditis being worse off. You're more likely to get myocarditis if you had the vax than if you didn't. And then COVID. It's all based on one study. Is the Israeli study. This one that was published in the New England Journal of Medicine. And it studied 304 people who had myocarditis symptoms, right? 304 people. And it found that a certain age group, the largest difference was males between 16 and 19, which is why you hear this perpetual myth of, well, the shot is worse for men between a certain age. So you have to break it down by age and whatnot. All right. So this is what they're basing all this nonsense about. And it is a scientific study. It's legitimate. It's published in the New England Journal of Medicine, which is why they always point to it. But they're completely ignoring after that a study of 58 million people by Penn State, 58 million that said, no, that's not true. You're 7 times more likely to get myocarditis if you haven't been vaccinated than you are with the vaccine.
And you get COVID.
Yeah.
Right. So like all these people who are like, oh, that hashtag died suddenly. And they always are like, did the person did they get jabbed? Did they get the jab? But also, did that person have COVID? Because that is the underlying condition that now most of our country, and that's the other thing, all these people who are so dismissive, like, oh, the only people it was a risk to are people who had comorbidities or underlying conditions. Everybody who's had COVID now has an underlying condition. That is your underlying condition now, even if you have no other. So on the next plague or in the next variant or whatever, when those of us who have had COVID die because the next one, our immune systems, and by the way, the whole idea that your immune system, that you build immunity towards new infections has been completely blown up. I'm trying to look for all of our different proof. I want all of our proof. Which I can't find right now, so I'll just talk through it. But that sort of like eugenics idea about whose deaths are easily dismissed because they have a comorbidity. Everyone who has had COVID is now considered somebody with an underlying condition. So the government or the people of the CDC or whoever likes to dismiss people's demise you will now be part of a group of people who is like expendable.
Yeah. Well, I mean, you take Door's video right there. He's saying it wasn't a threat to kill children. Well, I mean, children are dying like, very often. It became the number 8 cause of death among children. So children had nothing to worry about. And just if you look at deaths, it became the number 8 cause of death. So
and
why
I
would
just
you
want to
say children have nothing to worry about?
Yeah.
And I just want to add before you say something, because I'm the man here and you're going to cut me off.
I'm just going to let you go. Yeah.
Trash me. But all of their argument on the right and the minimizers about COVID have to ignore long COVID. They never, ever fucking address long COVID. Because if COVID doesn't kill you, that's how they look. That's the only way you can even fake the math on this stuff. If COVID has a lasting impact, they can't address this and say, well, masks don't matter and your kids are safe. And
right. Yeah. I mean, repeat infections lead to many different long COVID issues. Some of them are, mental health, which is sort of like more nebulous, probably fatigue, but kidney failure, cardiovascular issues, hospitalization. I mean, like there's a lot that can happen. And, the thing with now it's the 8th leading cause of death for children. And I saw somebody responded to me about that and said, oh, it's only 2%. But the first group, I think it's the number 1, I think, of respiratory viruses as a killer. And then other ones are, some of the deaths for kids are gun deaths and congenital disease, right? So like for things that you could actually avoid, it's up there. And if wearing a mask can help you avoid it, or even like, and again, as you said, they never want to talk about any other non-pharmaceutical intervention or anything else to protect us. This just came out and I was reading that. So there's a nasal spray containing iota-carrageenan, I'm going to say it wrong, that they are now saying reduces your risk of infection by 80%. But nobody talks about that. And, they've just taken away Novavax. I guess there's like millions of Novavax
shelved, and people have been fighting to get it, and they've been denied by a lot of doctors.
Yeah, and we're done. now we're done. We're just going to throw it all away. They said it's close to expiration. People have wanted it. And so this is how you create a vaccine duopoly. Now your only choices are Moderna and Pfizer.
And it fuels the argument of the people who are like, the mRNA is some scary, crazy technology that's dangerous. And, so Novavax was the only mRNA.
That really seemed like it was very promising.
Which was very promising, held up better to some of these new variants than a lot of the vaccines did.
Yep.
Although, this is the other thing, like boosters are effective. You should get boosters. If you don't want to, fine. I'm not going to force you to. I'm not saying that, but there's a lot of misinformation about how effective boosters are and that boosters don't help you. They do. And so the science is behind it is pretty clear that, and this is where we should be pushing back against Biden. The Biden administration wants to move to a once a yearly COVID shot, which is anti-science because the waning efficacy of these shots is proven. It's not ambiguous. It's not like, well, we don't know. I mean, we know that boosters work.
Right. But only for like 6 weeks.
But here's people are anti getting the boosters. And that's, if you support, if you're a Democratic shitlib centrist kind of person and you believe Biden's vax only policy, you should at least support the boosters, and nobody wants to get the boosters. They're not getting it out. And that's a failure on Biden's part.
Absolutely.
Entirely. And I'm not saying we should do that. I'm not, believe me, I just want to step back.
We
should be doing all the other measures as well.
Right.
But I just want to point out the failure of his administration is epic because his only strategy is the vaccine and boosters, and he's not getting people boosted. Yeah.
And if you want to restore trust in your public health experts and your CDC and Pfizer and Moderna, you take the profit motive out of it. And you can't
and you don't get rid of Novavax for one.
Yeah. Like you don't get rid of other
the alternatives to the profit motive.
Exactly. Also, I saw Ja just put out a thing because of course, you know that the executive order to make COVID an emergency, Biden's ending it. I think, when does it end? On, I think May 11th.
I think.
May. Is it March? Yeah.
I think you're right.
But so what that means is a lot of the testing, the treatment, any things that are being covered right now will stop being covered. It's mostly a financial measure for people. Of course, he just renewed the 9/11 state of emergency for the 21st year in a row or whatever that is. So Biden keeps extending Bush's 9/11 terrorism national emergency, but he's ending the COVID health national emergency. But, I saw, Ja put out some tweet thread where he was saying, this is what we're still going to do our best. And because of the, American, what was it? The Obamacare, what is it? Healthcare, ACA. We're still going to be able to give people shots for free or treatment for free, but it was kind of hedging. And it's like what we're hoping to do. And it's so important that you can still get treated for COVID. And I think one of the biggest issues, and, you and I think from the very beginning, we've been really clear about, we're both pro-vaccine. We both have gotten vaxxed and boosted and all that. But we have also, I think, been really understanding of why people might be vaccine averse or skeptical. And if you want to make people trust in this, you can't make it the one problem that is going to be covered by the government, right? Like, oh, we don't want you infected and infecting us, but you can die of cancer because you don't have health care or health insurance and you can't see a doctor. I mean, this is the perfect opportunity to employ Medicare for all or some kind of universal health care where you take the profit motive out, people can see their doctors, they can have relationships of trust where they're not thinking that you're just getting some shill for big pharma who's trying to, they posted how many billions of dollars in profit over this pandemic. This has been a boondoggle for them. It's been amazing. Of course, people are skeptical.
And when you see us not fight for the patents to be released, I mean, when I say us, the Biden administration, America, not fighting for the patents to be released. You see us allowing them to go from charging what are they charging the government, like $20, and now it's going to be 130.
Yeah, it's a 400% raise in price
for the vaccines. So, everyone who is skeptical of the government has valid reasons. Everyone who is skeptical of big pharma has valid reasons. Your job as the commander in chief is to get past those reasons, make it non-political, point out the science. But all we get is a message of take the damn vax. And so I understand people who are against it, but if you're against it, okay. I'll believe you're a good faith person and being a critical thinker if you'll wear a fucking mask, if you believe in air quality. The science on that stuff is not like, you could say we don't have the science on the vax and make that argument. We won't know until blah, blah, blah. But we know what masks work. We know that air quality matters. We know that stuff's, if you're arguing against that, you're a fucking idiot. That's it. Yeah. I'm sorry. So
totally anti-science.
You want me to have a conversation
COVID
with you? Tell me you believe in masks. Tell me you realize the effect this stuff's having on kids.
Yeah.
You don't have to believe in vaxes to say, okay, the actual math on the numbers of what's happening with kids is real. It's spreading in schools.
I mean, COVID exists. I don't know what that's like, some weird denialism, and this urgency of the return to normal is the virus isn't going to end on May 11th. 500 people dying every week. I just don't know how anybody can look at that. Anybody who considers himself or herself or themselves on the left, any kind of socialism, anything where you care for the commonwealth of people around you, to deny that this is a global pandemic and act like we should have just ignored it just because big pharma is making record profits, which is disgusting.
Yeah.
But you have to be able to separate those two out.
And separate, look, if our government is corrupt, fine. Our government's corrupt. If our big pharma in this country is fine. Every country on earth, big pharma and governments are all these doctors are colluding, except for the 10 people that you believe are not full of shit. Yeah. Those are the actual doctors we should trust. I mean, look at all the stuff. If you're going to question, if you're going to have a show like Doors and you're going to question, you're going to point out all the outlier voices, that's fine. That should happen. But that should also be challenged by someone with critical thinking skills who's on the same level, who's a doctor who can point out the fallacies of your problem.
Right.
And when you've got this issue like myocarditis, I will never pronounce that right.
Myocarditis, yeah.
And all your opinions are based on this old bullshit, and you're leading your sheep to fucking die because of this old study. I mean, at least have someone on to counter you.
Yeah.
Because you're spreading a lot of bullshit.
Yeah, it's really dangerous. And it is disgusting that there aren't more people on the left, the squad, Bernie, talking about using this as an opportunity to talk about public health measures. There's just a real lack of leadership in that realm.